Well, the doctor is in on the news from former President Jimmy Carter that he has cancer. President Carter offering few details in a written statement saying this, quote, recent liver surgery revealed that I have cancer that now is in other parts of my body. I will be rearranging my schedule as necessary so I can undergo treatment by physicians at Emory Healthcare. A more complete public statement will be made when facts are known, possibly next week. Dr. Johanna Bendell is director of the GI Cancer Research Program at Sarah Cannon Research Institute in Nashville, Tennessee. So, Doctor, we have some limited information from what you read from this statement. What do you make of what type of treatment President Carter will be receiving?
Well, thank you so much for having me. It sounds like right now what they're trying to determine is what type of cancer President Carter has. What we've seen is that he has widespread cancer, not only in the liver, but to other parts of his body. But what I'm thinking is that they're going to take the results from the surgery, that the tumor that was removed in the surgery, and try to locate where that tumor originated, which will help direct his treatment options.
And how long does that normally take to find those answers?
It can take anywhere from 2 to 3 days to potentially a week, depending on what that tumor looks like under the microscope.
And I'm sure those are anxious moments waiting to figure out where exactly the quote-unquote original cancer resided. Why does that matter, kind of tracing the cancer map to perhaps the first place where it started in the body?
So the way we based our treatments and treatment choices for patients with cancer is where the original cells were from. Even though somebody has tumors in their liver, it's not necessarily liver cancer if it came, for instance, from the colon or the pancreas. And so we need to actually determine the treatment based on the cells of origin, so we're making that right treatment choice for the patient.
We know, of course, that President Carter has a family history of pancreatic cancer, so there's been some questions raised about that. Of course, we don't know the answers until we know the answers from President Carter, so we'll wait on that. But I'm curious your thoughts on this, Doctor. Back in 2007, President Carter told the New York Times about how he was taking care of himself, and one of the things that he noted is that he would get MRIs and CAT scans on a regular basis because of this family history, but that he had stopped it and just started to do more blood testing as he reached his 80s. As far as preventative measures, what are your thoughts on that? Would an MRI or a CAT scan on a regular basis with someone with a history like President Carter be very effective in catching cancer at the earliest stages, or is cancer something that could really just develop almost overnight?
The best way to catch a cancer is when it's still curable, so in the early stages. But that's for cancers where we have good screening tests like colonoscopies for colon cancer and mammograms for breast cancer. Pancreas cancer is such a difficult disease because even if we do MRIs or CAT scans or imaging, the pancreas cancer often hides from us. And it very well could be that President Carter has pancreas cancer, but even now, maybe they haven't been able to see it on a scan, but it'll be determined by those cell samples that they got from the liver.
Wow. And so you say that's really key. If they could figure out where exactly the cancer is coming from, talk us through the range of treatment, because of course when someone says cancer and they say treatment, everyone thinks chemotherapy. But I know one of the things that you really look into is researching different drugs that we can use as well.
Right. We have so many new treatment options available to us now for multiple different cancers. So we have the traditional chemotherapies, but we also have agents that we call targeted agents, which are agents that attack the cancer itself or specific mutations within the cancer. One of the things that we're doing now with cancers is we're taking the cells from an individual patient and looking at the DNA and looking for mutations within the DNA that causes that cancer to be aggressive, and then finding treatments that specifically attack those mutations, which gives us potentially better anti-cancer activity and less side effects for the patient. Well, so many different options.
That's really great news, and that's an exciting direction that some of the research is going in. Just a final question for you, because this is often brought up in this conversation as well. President Carter is 90, although it's hard to even believe it, because here he was on a book tour and he's so spry. You know, you don't really think of him as 90 years old. But how does his age factor in with the treatment? With some of that treatment that you're describing, how do doctors think of a patient that's in their 90s?
Well, when you see a patient in their 90s, it all matters. How does that patient look and how active is that patient? For President Carter, with him being so active and doing so well in his 90s, he has a multitude of potential treatment options available to him, and he may do very well. For somebody else who's sicker in their 90s, then you might want to do something gentler or discuss whether or not chemotherapy or even targeted therapies are appropriate at all.
When you look at him, he's signing books, he's giving speeches, he's doing things that many people much younger are not able to do. So we, of course, are rooting for him. And when we find out more, we'll be able to discuss it more in depth. But Doctor, it's great to have you. Thank you very much. Very interesting.
Thank you so much.